There are three main types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. And of those three, melanoma is the most serious. And we treat it the most aggressively of those three types as well. The skin screening is really just a very thorough look at all of our skin from head to toe. And dermatologists will do the skin screening, and they are expert at being able to look at something on a person's skin and say, not a problem whatsoever, or that needs to be watched a little bit more closely, or even potentially biopsied. They're able to tell very quickly whether that's something that's concerning or whether it's something that we don't need to worry about at all. How often a person should get screened for skin cancer really depends on a number of factors. Their previous sun exposure, which is the biggest reason for developing really any type of skin cancer. It really depends on if they've had a diagnosis of skin cancer in the past. It also depends somewhat on family history. There are also some medical conditions which would make us be more vigilant about screening for skin cancers. Some people whose immune system isn't working properly, who are immune suppressed, might need to be screening a little bit more frequently as well, once or twice per year. We really work together in a team fashion. I think that works best for patients. In Minnesota Oncology, we have clinical trials running all the time for melanoma in various stages, whether it's in early stage melanoma or whether it's in people with stage 4 melanoma. We have a very, very aggressive clinical trial program, and that really serves patients well to be able to get cutting-edge medication for treatment of their disease. Because melanoma, and all types of skin cancer actually, do require that a person has a fairly big amount of skin taken off to make sure that all that melanoma has been removed, it may require some additional reconstruction. So within Minnesota Oncology, we take a multidisciplinary kind of approach to patient care, and included that on the care team is plastic surgery. And we have our own plastic surgeons that we work with very closely, Dr. Sam Economo and Dr. Valerie Lemaine, who we all work together to get patients to where they need to be with regard to plastic surgery. If you're going to be outside really for any amount of time, particularly during the summer months here in Minnesota, you just need to be using sun protective clothing. Can be very helpful. Stay out of the direct sun as much as possible and use sunscreen. 5-6 years ago, we really had almost nothing to treat patients with. And now we have half a dozen treatment options for patients, including immunotherapy, including targeted therapies, all of which have really helped to extend a person's life and improve quality of life for people with melanoma.